It just takes everything away from them. I mean, I have treated a lot of patients who have been using heroin or other drugs, and they have literally felt that they're just going to die doing this because this is the way their family was. They have lost their families to addiction, and that's all they see in their lives. And initially you do it to get like a little bit of high, as they call it, but later on it's just not to get withdrawal from the drug. And there is literally no high, but you're spending your entire money trying to get get the drug. You're trying to put your life together, but you can't do it. You're losing your children. Everything falls apart. I think first we deal with the medication. We first want their symptoms to be clear. So when the patient comes in, we typically dose them. We first find out whether they have a drug problem, how much are they willing to take care of it. We bring them in. If it's for opioid use disorder, we bring them in and we dose them. We give them the Suboxone. They come in for 3 days. It's called induction period. And then after that, they go into what is called maintenance period. Then they come in every week, then twice every week, and then once a month. And then they keep on seeing the clinic. So that's the part to take care of the withdrawal symptoms. Besides that, there's also a lot of ancillary staff. We have a social worker. We have, they talk to me, they see me every week. They talk to the counselors. They have nurses. So they, I think, get a lot of support. We also help them with others, psychosocial part, if they need help with that as well. So Suboxone, I'm specifically talking about Suboxone that I'm doing right now. It is called buprenorphine naloxone, and what it does, it goes and binds at the opiate receptors. Normally, the heroin or any kind of opiate binds at the receptors, and it activates the receptors. So it produces, so you can think of it like it produces light at the receptors. It gives them all that they need by using an opiate. What we really do is we give them Suboxone, which now goes and binds at the opiate receptor and occupies the receptors. It does not produce the same amount of effect at the receptors, but it's got a relatively low intrinsic activity at the receptors, so still produces some effect, and that kind of helps alleviate their symptoms. Once the receptors are occupied, they don't have as much cravings and they don't have withdrawal symptoms. And that's what our target is, that we get rid of their withdrawal symptoms, we get rid of their cravings, and so that they can have a normal functioning life. With Suboxone, pretty much almost immediate. So as long the patient comes in, we tell them don't use for about 24 hours at least before coming in for the dosing. They come in, they take the medication, and within like 30 minutes, they can actually start feeling the effect. Their withdrawal symptoms tend to start going away. And then the first day we give a very minute dose because we just want to make sure that they're not having withdrawal symptoms or they don't have a reaction to the medication. But by second day, when we dose them to about 16 milligrams, they actually feel a lot of relief and they start feeling better. I think stigmatization probably would be quite a big barrier. Then, taking or finding provider. Where do you find a provider that can do that? Most of the patients, they will feel that they'll be judged. They'll be treated different. And I think once they come to the clinic, at least as part as we feel, I think they get a very non-judgmental stance from us, and I think that's what brings them back. Also, sometimes they think they don't have money, and that's another reason that they would say, I don't think I can afford this, and that's another barrier to their treatment. Sometimes, spouses or people in relationships are using it together, and if one is not ready, the other person is not ready. It also depends on how motivated they are to seek treatment, and that is also another big barrier. It is environmental and it is biologic, and I tell all the patients who come to me, do not label yourself as an addict. I don't even use that word. I say it's an opioid use disorder, say if it's for opiates, or if it's alcohol use disorder. So you've got something partly environmental that people around you were using, but you were also predisposed to it because you have a biological component to it. You have genetic sensitivity to it. And if you take histories of most of these patients, they will tell you that somewhere along the line, either somebody in the family was using heroin or parents were addicted to another drug, maybe not the same drug, but there was addiction going on in the family. I think the biggest take-home message for me is that, this is something we can take care of. There is an epidemic going on right now, and people have to come out and, call doctors who are out there and try to get the medication. Get the medication, get settled first, and then, you will be motivated. You'll be able to walk it through, and then put your lives together. I do have an example of one of the cases that I had seen in my practice, where I had somebody who was using every day, had lost his mother, his sister, and his brother, all to heroin addiction, and all IV drug use. And so his thought process was that I'm going to die a heroin death, and would use every day, till he met us and came to our clinic. And after that, he was able to put his life together. He stopped using, he was able to get married, and has 2 children, and has a functional job. And he has never looked back. Was it difficult for him? Yes, it was very difficult for him. Did he have to face a lot of challenges? Yes, he did face a lot of challenges. But was he able to put his life together? Yes. He doesn't even look back. He is very functional. He has he's earning, he's making good money, and I think he is living his life. So it is something that is treatable, and I think people should come out and seek help for it.
Well, basically, my cousins were addicts. They use a lot of drugs, IV use and stuff. I had got in a little bit of trouble, and I went out there to stay with them. And that's how I kind of got introduced to it, the high of it, things like that. But what really got me dependent on them, I got into a car accident in 2007 where I was put in a neck brace and stuff for a little bit, and I was prescribed pain pills. After a month or 2 of taking them, when I didn't have them anymore, I experienced withdrawal symptoms. So I kept myself from withdrawing and continued the use of them for almost 10 years. One of the main things that I noticed was aching in my legs, and then of course the sniffling and things like that, but I was just very uncomfortable. When you talked about going to work, athletic things with your children, I do have 3 children, a lot of that was hindered when I was withdrawing. And unlike a lot of people on pain medications where they're real drowsy, makes them sick to their stomach, it didn't do that to me. It woke me up, I was energized, I wanted to work longer, you know what I mean? And I didn't really get sick from them. And in fact, the more my addiction got, the more I felt like if I got sick, I was high, you know what I mean? It was a good thing to me, not a bad thing. There was times, like I've had kidney stones several times, other things that had happened where getting in an emergency room or going to the doctor, and then you would get 20 or 30 of them. Now you may get 3 or 4 because it's, the opiate epidemic, but then you got a lot more of them. And all I would have to do was keep that pain pill bottle, as far as getting U8 on probation, U8 at work or anything like that. I had that prescription bottle, didn't expire for a year, you know what I mean? So I was good to go. But you'd be surprised at how easy it was then to get them off the street. Now it's a little bit harder because what people are getting, they really need them for pain. They're not wanting to come off them. I mean, I'm not even trying anymore because the Suboxone to me has changed my life around. To every situation, you have your ups and your downs. The upside of feeling high, wanting to work longer, things like that. Well, there's a downside to that too, your irritability level. When you spend most of your time calling people and texting people, I mean, sometimes people you wouldn't normally even ask, trying to find pain pills. That's what you almost devote your whole life to. And your marriage is on the line, your kids are getting older, they're not stupid, they see what's going on, you know what I mean? It was my marriage or my addiction. And at first I didn't know that the Suboxone help was there. And me and my wife had separated for a little bit. I was staying with my cousin, and his girlfriend had gotten on Suboxone. And I was kind of going on about it and stuff. She was like, well, you know there's help. And that's when I ended up contacting KU and setting up an appointment and getting the help. I was really nervous. I didn't know if maybe there was a catch to it, like, well, okay, but, you know, maybe you end up getting in trouble or something like that. So it took a lot for me to do it. But Laura, when she did the, well, what you'd call, I guess, an exam over the phone, she really made me very comfortable. You know, she told me that, you know, I had to give her some information about, you know, how I became addicted and how long I was addicted and what use I did. But she told me every time, you know, if they get to a point where you don't want to talk about it or whatever, just let me know, you know what I mean? She really eased my mind and making me feel that this is really help, not something that's going to end up backfiring on me. And so, yeah, it was cool. Well, I'd like to think that as much as I don't want to be dependent on a drug, that I could eventually even kick the Suboxone. But it's kind of mind-blowing that they have developed something that you can dissolve under your tongue that will actually stop you from withdrawing. But it works. It really does. I mean, don't get me wrong, I don't really get high off of it. So do I crave sometimes? Absolutely. But I'm stronger than that. And I wanted this more than I was forced into doing it, you know? So I just tell myself, William, you know, you put that in your mouth, you're gonna go right back to it, and you're gonna possibly lose your marriage, lose your job. I just can't do it. I won't allow it to happen.